The first day of the HASA conference, seeing various of the role players streaming into the Sandton Convention Center to form part of the high-level conversations centered around healthcare, but adequate healthcare provision in the country. One of those would be the South African Medical Association. We see them taken to the podium this afternoon to give us a sense of the work that they've been doing over time in solving for the country's healthcare sector. Obviously, this coming through at a time when the buzzword would be the National Health Insurance, and how that would play itself out to be rolled out. Again, we see emphasis being put on innovation and technological advancement in tapping into really advancing the healthcare sector in the country. And Sama will be joining us in a moment to give us a sense of that. But at the same time, we see various of the exhibitions taking place here that will be centered around really the future of healthcare in South Africa. I'm going to invite into the conversation now Dr. Ziyanda Mgugudo-Sello, who will just give us a sense of the work that Sama has been doing over time. We saw you giving us a presentation, and technology was at the heart of what you were championing there. Maybe give us a sense of how we find you here, but also the importance of tapping into technology in rethinking the future.
Thank you very much. So as medical doctors, we are trained to see patients. But what we find ourselves in is that in a situation where we are inundated with a lot of administrative work in addition to these patients that we see. So the question then becomes, we have got artificial intelligence, which is a way in which it can help us to improve the efficiencies that we have in the health system. So the question is, how then do we integrate artificial intelligence into medical practice? And that's why we are here. As the South African Medical Association, we really do see a space for artificial intelligence in medical practice. There are things that can be automated, that a doctor doesn't need to do. You know, for example, if a patient walks into my consultation room and I'm busy writing notes instead of listening to the patient, there is a space for AI to scribe for me while I see and have that contact with my patient. And so for us, we are looking at those type of innovations that can work together with the doctor. But I think the main thing that, the conversation we're having that is quite core today is the fact that in South Africa, the medical records, all of us have got different sets of medical records sitting in different places. And therefore, the question is, how do we integrate the medical records so that we are able then to generate data that can also be useful in this time of AI? So in this room where we were, it's not only medical doctors that are there. There is regulators, there were medical schemes, there is hospitals. We need to come together so that the information that we even input into this digital space is information that is comprehensive, it is information that is accurate, because without inputting the correct information into the system, then we can end up having wrong data that we're working with that is generated by this artificial intelligence.
And Dr. Mgugudo-Sello, what do you say then to some people that would come through to say, as we champion technology, we tend to worry about the labor space, the work that is supposed to be done by a human being, and now we're seeing technology moving into that space. As we try to innovate, how do we respond to some of those fears?
So we are very clear that AI is not here to replace human beings, because we as human beings, we've got a higher intellect compared. Remember that with artificial intelligence, it is data that is inputted by somebody else. So you still need the person with the expertise to actually look that what is being, that which is being reported by the AI is actually accurate. So I make an example. There's this term of AI hallucinations, where the AI will generate according according to what has been inputted, right? So if you still don't have the correct skill in place to ensure that that is correct, then we're going to end up in disarray. So we don't think that AI replaces human beings. AI improves the efficiency of the work that you do as a medical doctor.
Yeah, and finally, before we let you go, we know very well that in the country right now, even HASA has taken government to court over the rollout of the national health insurance in its current form. They would want, to see various tweaks here and there. Where do we place technology? When we think about the future, when we think about universal access to healthcare, does technology have a room there, or can we tap into it to ensure at least that some of these things that you've highlighted are championed through the NHI and technology, at least we are on par with where we're supposed to be?
According to the World Health Organization, technology is one of the building blocks for any health system. So we cannot shy away from technology. It's a must, right? And the situation where we find ourselves now as a country is that we are, the private sector, even in the public sector, we don't have sufficient hardware and software for us to be able to move towards implementation of AI, for example. So we are saying, even in this fiscal climate, we've got to think about putting money aside to ensure we've got hardware, we've got software, because data and information technology is part of the building blocks of a health system in any country.
All right. Dr. Ziyanda, thank you very much for giving us your time. Dr. Ziyanda Mgugu Doselo, giving us a sense of what they're doing there at SAMA, and you hear her saying that we would be left behind if we're not capitalizing on where we find ourselves with technology. But those high-level conversations continuing well into the afternoon, and tomorrow we'll be marking day 2 and the last day of this conference here. I'm Katlego for SABC News at the Sandton Convention Center.